Men, do you know that prostate cancer is common, but it's often curable if found early? So, welcome to Health Talk with Dr. Gifts. So, today we will be talking about prostate cancer screening or prostate cancer prevention. So, what is prostate and where can prostate be found? Prostate can be found between your bladder and your ureter. So it's like a small pea nut, a small nut, wild nut that is between your big bladder and your ureter. So it's surrounding that space. It produces some fluid that helps to lubricate your ureter. So this organ can be affected by cancer, which we already know the meaning of cancer. So who is at risk of developing cancer? Someone who is from Africa, someone who smokes, someone who has family history of cancer. So what are the tests that we can do to prevent this from happening or from preventing us from getting you when you already have cancer? We can do prostate surface antigen. We call it PSA. This test shows us if the surface antigen is increased, it shows us that things is happening. It might not be the prostate itself. It can be increased by a lot of factors, but we have to probe further to be sure it's not prostate. We can also do digital rectal examination where your general practitioner will put her hand or his hand in your rectum to check the surface of your prostate. So after that is done, it gives us another information. And how can you prevent yourself from getting this prostate cancer? You have to be eating healthy. You have to be on a good weight. You have to also avoid processed meat. And also, another thing you can do for yourself is to ask your doctor, do you need a checkup on your prostate? Do you need to check your prostate? And if you find out that you're having difficulty urinating, or when you want to urinate, you take a lot of time for the urine to start, and when you finish urinating, few seconds later you feel the urge to urinate again, that is a good sign that your prostate is enlarged. It may not be necessarily cancer. It could be BPH, which is benign prostate hyperplasia. So book an appointment with your doctor and ask your doctor, do you need tests for your prostate? Bye.